Hello, I'm Dr. Richard Brandon with Bio-LifeMD, located in St. Mary's, Georgia, just 30 minutes north of Jacksonville, Florida. Today I want to discuss an often undiagnosed and undertreated problem, hypothyroidism. On a daily basis, a new patient in my office will have some or all of the following symptoms: cold hands or feet, dry skin, fatigue, hair loss or thinning eyebrows, difficulty losing or maintaining weight, and brain fog. When I suggest they may be hypothyroid, they will say they have family members with hypothyroidism, and since they had all these symptoms, they have suspected that they had it also. Many will say, my primary care doctor has checked and the TSH lab test is always normal. I then proceed to explain the most primary care providers are following the hypothyroidism guidelines established by the Endocrine Society and the American Thyroid Association, which are thought to be the gold standard for diagnosing and treating hypothyroidism. The guidelines say the TSH, or thyroid stimulating hormone, is the best test to diagnose and follow hypothyroidism. They also say the only medications recommended are Synthroid or levothyroxine, which are synthetic forms of T4. The thyroid produces two main hormones, T3 and T4. T3 is the only one that has receptors in the body, so it's the only form that is active. T4 is simply a storage form and must be converted to T3 to become active. This conversion is dependent on an adequate supply of iodine, selenium, copper, magnesium, and others. It should be noted that 97% of Americans tested have iodine deficiency, and there are many reasons for this, two of which are not good. The government has been putting fluoride in our drinking water for over 50 years. The commercial bread makers switched from using iodine in their dough to bromine. Since these two toxins are halides, like iodine, they displace iodine from its receptors and cause iodine deficiency. The guidelines state that the TSH blood test may not be accurate in an iodine deficient area, yet they don't tell us that the USA is iodine deficient. The guidelines say desiccated thyroid, such as Armour thyroid, NP thyroid, and Nature thyroid, which have both T3 and T4 in them, should not be used, even though they have been successfully and safely used for well over 100 years. Since many statements in the guidelines did not seem reasonable, I went back to the back of the guideline booklet where they give reasons for their recommendations. What I found were that many reasons given were expert opinion with no other explanation. I decided to see who these experts were on the guideline committee. Lo and behold, the chairman had received financial compensation from Abbott Labs, the maker of Synthroid, the #1 seller for hypothyroid medication in the world. It is also important to note that Abbott and other generic levothyroxine makers contribute massive amounts to the Endocrine Society and the American Thyroid Association. In summary, many providers are using the wrong lab tests to diagnose, the wrong medications to treat, and they are still using the reference ranges list on the lab results sheet, which have absolutely nothing to do with normal ranges. It is important to listen to our patients and to find a provider that understands how the pharmaceutical companies work their magic. Thank you.